and welcome to the Roundtable on the role of race and ethnicity among formerly incarcerated persons. I want to thank you so much for being here, and I apologize for the delay that we had with our technology, but now we're ready to get started. I'm Karen Kurasaki, Senior Associate at the California Institute for Mental Health, and I will be your chair for today. Once again, thank you all for being here. I'm really glad to see all of you. The room is full, and that's very encouraging because that says to me that all of you share the recognition that this is a really important topic that we need to be talking about today, and also share an interest in learning more about it. Since the passage of the AB 109 legislation in 2011, we certainly have had an increase in focus and conversations about the incarcerated population. However, frequently absent from those conversations is how many people of color are incarcerated. According to Michelle Alexander, the author of the new Jim Crow Mass Incarceration in the Age of Color Blindness, the United States imprisons a larger population of its black population than South Africa did at the height of apartheid. In our own nation's capital, 3 out of 4 young black men, it is estimated that, I should quote her correctly, it is estimated that 3 out of 4 young black men can expect to be incarcerated. And similar patterns can be found in other black communities across America. In today's roundtable, we will have a chance to take a close look at those disturbing disparities. We'll have a chance to explore racial identity development and race-based trauma, and we'll be able to learn about some community-defined practices for promoting healing and recovery among persons with mental health issues and addiction problems, who are persons of color and who have been formerly incarcerated. And finally, we will wrap up the day with a 7-way dialogue amongst all of the presenters, and we'll talk about what it means, and we'll hear from them about their vision about where we need to go from here and how do we get there. Our moderator for the morning panels is Maátisák Amenhetep. I just introduced her a moment ago, but let me tell you more about her. She is a licensed clinical social worker. She is a consultant to CiMH and maintains a private practice in Sacramento. She has over 25 years of clinical experience specializing in treating victims of trauma, including combat veterans with PTSD and prison inmates. She teaches graduate courses at Sac State, University of Phoenix, and the Professional School of Psychology. She has researched and published on the topic of media standards of beauty and the self-image of African American women. She is incredibly insightful, and as I said, she was just delightful to work with in putting together this roundtable, and it is with great pleasure that I introduce to you our moderator for this morning, Maátisák Amenhetep, and our presenters.
Thank you and good morning. I'd like to take this opportunity to introduce our 2 panelists. First, it's Dr. Becky Pettit. Dr. Becky Pettit is professor of sociology at the University of Washington. She is the author of 2 books and numerous articles. And her newest book, Invisible Men, Mass Incarceration, and the Myth of Black Progress, we'll be hearing about in a moment. So welcome, Dr. Pettit. Dr. Terry Kupers practices psychiatry in Oakland and is a professor at the Wright Institute in Oakland. He is the author of Prison Madness, The Mental Health Crisis Behind Bars, and What We Must Do About It. And that's actually how I met him in 1999. So welcome, Dr. Kupers. So I want to start with you, Becky. You're the author of The Invisible Men, Mass Incarceration, and the Myth of Black Progress. Can you tell us about your research?
Yes, thank you. Thanks for having me. So I want to tell you a little bit about the book and where it came from. A few years ago, a collaborator and I, his name is Brian Sykes, he's now an assistant professor at DePaul University in Chicago. We're trying to estimate what the lifetime risk of imprisonment for people in different socio-demographic groups. That is, what are the chances that someone, say a white woman with a college degree, would go to prison, at least a year in state or federal prison by the time she reached age 35? So we were looking at this, we were just trying to update some estimates we had done about 10 years earlier, and what we found was curious. We found more young black men who dropped out of high school were in prison or had been to prison than were alive. This was a puzzle for us. And it was an empirical puzzle. I didn't start my career intending to study incarceration. I was interested in studying inequality, but it turns out that you can't study inequality in this country without devoting attention to the criminal justice system and its disproportionate impacts on people of color, particularly young men. So that motivated the book. The title, Invisible Men, comes from the work of Ralph Ellison. In the prologue, he writes, "I'm invisible, understand, simply because people refuse to see me." So in the book, the object was really to try and understand, where were these men? Why were they missing from our national data collection systems? And what implications does that have for how we understand inequality? And the basic argument in the book is that our national data systems and the social facts that we produce are based on a normative kind of economic and domestic life, one that categorically excludes inmates.
Dr. Pettit, many people believe that the conversation about racism and inequality is outdated and irrelevant, that racism is sort of a thing of the past, and can we all just get along? And but your findings sort of strike a dagger in this modern day notion at all as well. What does the data and statistical research say, and what are the actual rates of incarceration?
That's a great question, and is now a good time for me to sort of give a little historical? Yes. So I'm going to situate the work, the contemporary issue, in a historical frame. We collect data about the population because we're constitutionally mandated to do so. We fill out a census every 10 years. Primarily, the only constitutionally mandated reason we collect census data is for the purposes of congressional apportionment. But we use those data and other kinds of data for lots of different reasons. In 1865, during the height of the Civil War, President Lincoln signed what was called the Morrill Act. The Morrill Act provided for land grants to colleges. In order to provide land grants to colleges, the federal government needed more information about the needs and capacities of the population, so we started collecting more information. It wasn't just how many people lived in different places, but we started collecting information about education, employment, and other things. And that information is still used today, not just for policy evaluation, it's also used for social science research. In the 1930s, during the height of the Depression, there was a lot of debate about what was the poverty rate. The Hoover and Roosevelt administrations debated this. We knew a lot from qualitative work. We knew a lot from the careful photography of WPA photographers like Dorothea Lange about poverty, but we didn't know at a national level about the depths and distribution of poverty. And so in 1939, we started collecting a survey, which was called at the time the Sample Survey of Unemployment. In 1942, that became the Current Population Survey. When you hear that the unemployment rate is about 7.5%, those data come from the Current Population Survey, a survey of 50 to 60,000 individuals that live in households. By definition, it excludes everyone who doesn't live in households. By definition, it excludes inmates who live in correctional facilities. In 1964, Lyndon B. Johnson signed the Voting Rights Act. At the same time, the Current Population Survey started collecting information about voter turnout. And those, when you heard in 2008 that the voter turnout rate was the highest it had ever been for African American men, that data came from the Current Population Survey. So in 2009, January 20th, 2009, Barack Obama stood on the Mall in Washington, D.C. and swore to uphold the Constitution and all it entailed, including all the data collection it entailed. And people made lots of claims about black progress. Surely there has been black progress. And we can very easily point to a number of people, including Barack Obama and his rags to riches, his very compelling rags to riches story. But at the time of his inauguration, there were 2.3 million Americans in prison or jail. Approximately half of them are black. And all of them are excluded from our national data systems. And so the basic argument in the book is that the mass incarceration over the last 40 years has led to the disproportionate exclusion of certain subgroups of the population, most notably young African-American men with low levels of education. And that's led us to overstate progress in education, employment, in voter turnout, and a host of other things. And I'll just illustrate this very quickly. This is the prison and jail population. The growth, it's been dramatic. It has not been accompanied by increases in crime. In fact, crime is at historic lows. And so when we talk about incarceration, we're talking about a public policy initiative that has disproportionately affected certain subgroups of the population. It's not 1 in 1. The incarceration rate is 1 in 100. This was at the time of the first Obama inauguration. 1 in 100 American adults is incarcerated. If that were equally distributed across the population, might not be such a big issue, but it's not equally distributed across the population. Among young black men who've dropped out of high school, 37.2% can expect to be incarcerated in prison or jail today. Today, 37%. We estimate that 70% of young black dropouts spend at least a year in prison.
That's a lot.
Right, in contrast to about 30% of all African American men, which is still a lot. And what that means, just for an example, when we're measuring things like the high school dropout rate, if we use data like the current population survey, we find in 2008, 7.2% of non-Hispanic whites and 13% of non-Hispanic black young men didn't complete high school or a GED. If we include those who are incarcerated, that number is much higher for both groups because inmates are disproportionately drawn from the lowest levels of education in every sociodemographic group. And that difference is 11 or 41%. I ask my students, is 41% a lot? And I say, look at the person next to you. If they're doing the same work you're doing and they make 41% more, is that a lot? They have very strong feelings about that. So these and other issues are the things that I talk about in the book, Invisible Men. And I devote attention to education, employment, voter turnout, as well as health and healthcare issues, which are increasingly important and relevant today.
Okay. In Dr. Michelle Alexander's book, which Dr. Kurasaki mentioned earlier, The New Jim Crow, Mass Incarceration in the Age of Colorblindness, she describes this phenomenon of mass incarceration and says, she makes this statement, there are more in prison now than in slavery. In your opinion, does this epidemic harken back to a similar time in our history? And if so, what are the parallels? And might this be an example of history repeating itself?
Yeah, I think that's a great question. And I think it's really important to consider the long history of the different ways in which we have excluded certain subgroups of the population. And so it's not coincidental that I go back to the constitutional mandate to collect data about the population, at which time we had the 3/5 rule. And so African Americans were counted, but they only counted as 3/5 for the purposes of congressional apportionment. And I certainly agree with Michelle Alexander on this point, which is that we're excluding African Americans to about the same extent today through a different mechanism, mass incarceration. And the other thing that's really important from my perspective is that the exclusion is intentional. We can and do count inmates very, very well every day, multiple times a day, and there are lots of incentives to count them well. But at a national level, we don't. And so it strikes me as a very institutional exclusion that disproportionately affects African Americans.
Now, you made the statement that it's deliberate. Can you elaborate on that?
So that's part of the reason I wrote the book the way that I wrote it, and that's part of the reason I talk about it a lot. Is that it's remarkable to me how many people claim they don't know They don't know that there are 2.3 million Americans in prison or jail and another 5 million under the surveillance of the criminal justice system. They don't know that African American men have a 1 in 3 chance of spending time in prison, at least a year in prison. They don't know that these are remarkable to me because this is what I study. So it's not so when I give talks and I talk to people, it's surprising to me that people don't know. And I think part of what I'm trying to do is to help educate people so that they do know, help educate policymakers so they do know. And I think that while in many ways my work comes across as a criticism of our national data collection systems and the Census Bureau, there are lots of people working at the Census Bureau and other places that are doing the very best they can. But they're making certain decisions that preference certain ways of living over other ways of living. And so, for example, the Census Bureau in the late 90s and early 2000s made a decision to enumerate inmates where they reside, not where they come from. And they did that and the argument in the written record is that for reasons of efficiency and cost. It's easier to count inmates for the purposes of the census and for the purposes of apportionment in a facility, in a prison facility, a prison or jail facility, and not to actually go in and ask them, where did you live before you came here? And it turns out that's really important. It's really important for political representation. It's really important for how we spend money, going back to the height of the Civil War and where we made collective decisions to allocate resources to states and localities to meet the needs of the population. And so if we're targeting educational resources to the counties that house prison and jail facilities and not to the counties where those men and their children may live, it is in many ways a misuse of the data. So, so I think how intentional it was to get here, I don't want to make really strong claims about that, but now that I think people know, the question is, what are we going to do differently?
Thank you. I want to move on to Dr. Kupers. Dr. Kupers, you wrote a powerful book called Prison Madness, The Mental Health Crisis Behind Bars. Can you share your work with us?
Yeah, so first I'm extremely proud to be here and happy that you're doing this conference. 50% of prisoners are black. That is a stunning indictment of the racism of our society. And in that one piece of information is contained all of the problems of our society and of the prison system. I think people are disappeared behind bars. And I think the people who are disappeared, and all of us, I think most of us work in public mental health, they're the people who are not served as society cuts the social welfare safety net. So the people who are not served, which is disadvantaged people, selectively are sent to jail and prison, where they don't get served. And they get tortured, basically. They are traumatized in very many ways. Now, the fact that disproportionately people of African descent and Latinos, people, minorities, people of color, are sent to prison is a statement about our society. I follow people with serious mental illness. I was trained as a psychiatrist and a community psychiatrist. I worked in the state hospitals. I worked in the community. We deinstitutionalized. In the 1970s, I was asked to investigate LA County Jail. And I was shocked and horrified with what I found. I found the 50% black, probably 60% in LA County, and probably 20 or 30% Latino. And I found stunning mental illness, worse cases of mental illness than I had ever seen in my training. And they were left to kind of just vegetate. They were left to hallucinate. The suicide rate was extremely high, as you know. So I started testifying in class action lawsuits about that, about the conditions of corrections, the crowding, which causes an increase of mental illness and violence and suicide. And we know that from good social science research. And I started investigating what was going on with people with mental illness. There's an assumption, I think, in society that if you really want treatment for serious mental illness, best place to be is in jail, because that's where they have the people with mental illness and that's where they do the treatment. It's untrue. If you watch the budget, the correction budget doesn't decline. The education budget declines, public health, mental health, they all decline, right, with budget cuts. The correction budget stays constant, but within a deviation of a few percentage points. But if you watch the mental health item within corrections, you see that that actually declines the same way that the mental health services in the community decline. So there's really inadequate mental health services. Now, when you walk into a prison, you see the racial dynamics of our society. That is, if you walk into a segregation unit for people who supposedly are either gang members, or have done broken rules, or been violent, or whatever, you find almost entirely people of color. And if you walk into a mental health treatment setting, you find or a job training program, you find almost entirely white prisoners, even though they are a minority in the prison. It's stunning. And I want to talk a little today about trauma.
Please, yes.
There's serious mental illness that we know about, schizophrenia, bipolar, that kind of thing, major depressive disorder. There's also trauma-related disorders. In prisons and jails, they tend not to get attended to because they're considered not major mental illness. There was some stunning research coming out of the south side of Chicago in the early 1990s that 59% of fifth graders in the south side of Chicago have seen a dead body in an other than funeral kind of situation. That was stunning. White professionals didn't know what to do with that information. We couldn't imagine it. White kids don't see dead bodies except for, occasionally. But for 59% of the fifth graders to have seen a dead body, and this is a dead body in their home, a drive-by on the street, violence, it was stunning. And we turned our attention to trauma and the multiple traumas that go on in basically inner city kids, people of color. And someone had the idea, Angela Brown did a lot of this research, of going into the jails and prisons and asking how much trauma there had been in people's lives. And what we found is a stunning amount of trauma. So that, for instance, sexual and physical abuse among women prisoners, 80% of women admit it happened, probably a lot more, had it happened. And that makes us look again at, first of all, the adjustment of people in prison and the mental health services that are being provided. Let me say a general rule to start, and then we can talk about it more. But in general, if a person of color misbehaves in jail or prison, they are punished. And if a white person misbehaves in jail or prison, with some exceptions, they're examined as a possible mental patient. That is, that their command hallucinations made them do what they did or something like that. So there's a differential. In the old days, they called it the mad and the bad. And that is, if you're a person of color, you're just like on the street. If you're picked up by the police and you're a person of color, you're more likely frisked, you're more likely arrested, you're more likely charged heavily, and you're more likely convicted and go to prison or jail. That's why 50% of the prisoners are black. It's not that there's a difference in the crime rates. We all know that the use of drugs among adolescents, for instance, actually is greater in the white community than in the black and Latino communities. The rate of stops on the street is massively higher in inner city communities. In those stops, the number of kids who get arrested is a much more proportionate people of color, and then all the way through the criminal justice system. The charges that are brought, the conviction rate, the use of the 3 strikes, almost a huge majority are people of color who get 3-strike convictions. So there's bias all along the way, and we can analyze what that bias is. There's also bias about how sympathetic we are to the pain of people. Oppressed people's pain matters less to the dominant group than their own pain, right? Just as a general notion. Well, if you look at the amount of trauma in people in the criminal justice system, which is massive, and how much of it is sensitively responded to, for instance, with mental health services, there's a great discrepancy of people of color and white people. So that white people's pain is viewed more sympathetically than is the pain of people in color. So here's my thesis, and we can discuss this today, but trauma leads to a lot of illegal acts. That is, that the illegal acts that people get arrested for, specifically and most strongly correlated, is substance abuse. Substance abuse is very frequently self-medication for trauma that's been unattended to. And so you find a lot of trauma in the substance abusing population. Now, if we were to say, have some sympathy towards someone and say that their trauma early on, the multiple sexual and physical traumas that they went through, led to their substance abuse, therefore we should view it as a treatment issue, which is to get to the prison madness idea, they would get treatment instead of punishment. But if we viewed it as bad behavior that is willful and destructive, they will get prison, and in prison they'll get punished, for instance, with segregation. So now what happens with the racial dynamics in that regard? People who are white are more likely viewed sympathetically and offered treatment. People who of color are more likely viewed as bad, as super predators, as the worst of the worst, and locked up, for instance, in solitary confinement. Now what that then matters in the post-release for persons who were formerly incarcerated is that the situation is identical. I mean, people of color are the last hired and the first fired. You know, the San Francisco banned the box movement. The box, it's a double entendre. In prison, the box is segregation. It's the hole. But the box that they're banning is when you apply for a job, you're asked on the original screening checklist, have you done time in jail or prison? And the ban the box was to get rid of that box so that potential employers would not know your incarceration history. Michelle Alexander, is very important what Becky has written and Michelle Alexander's book and others like the Sentencing Project in Washington, because this is all very secret. People are disappeared into prison. And for instance, the fact that 50% of prisoners is black doesn't bother most people in society because they don't even know it. So it's very important that you've written the book about it. So when you check the little box, you don't get a job. So ban the box was a very important movement, differentially affecting people of color since they're more often locked up. Michelle Alexander says that 80% of adult African-American men have had some criminal justice, jail or prison experience. Well, what that does to their potential for future employment is extremely important. The other thing that's important is that the effects of trauma which continue into prison, when someone is, their unacceptable behavior is deemed to be bad rather than emotionally driven, and they're punished, for instance, with solitary confinement, that creates a new trauma. Spending time in solitary confinement is actually very traumatic and very destructive. For instance, one of the symptoms I find in people who've done a lot of time in isolation is a tendency to isolate themselves, fear of public places, and trouble in relationships. Now think about someone coming out of prison. If they're having trouble in that regard, how are they going to create a family life? How are they going to work?
I wanted to follow up on, you talked about the trauma that they experienced prior to incarceration and then the trauma experiences in prison. How bad is it behind bars?
Well, there's a lot of attention today to solitary confinement. Senator Durbin just had a hearing on Tuesday about solitary confinement. It's been overused in this country. Solitary confinement is the place in prison where you find the highest proportion of people of color. It's extremely traumatic. We have, in mental health, we talk about reenactment or re-traumatization. That is, someone is traumatized, and as I said, 80% of women going to prison have reported sexual and physical abuse multiple times in their childhood and adulthood, domestic violence, that kind of thing. You put them in prison, you subject them to a strip search. A woman who's been raped is strip searched by multiple officers and held down. What is that? That is a re-traumatization. Now, we're more concerned, I mean society at large is more concerned when that happens to a white middle-class person. A woman of color who is held down and strip searched and it re-traumatizes her, that gets little attention, and if she complains, she's seen as unruly. So amount of attention we give to the emotional pain of people is almost entirely correlated with race in our society. And so what happens is that the solitary confinement, crowding itself, there's an increase of all kinds of violence with crowding in the prisons. And as you know, our jails and prisons are very overcrowded. I think that's why the violence rate is so high. But also there's a much higher rate of sexual abuse in prison, of violence, and that sexual abuse and violence becomes another trauma. So people, now let's take all of that and move it over to the population with serious mental illness, because we have a disproportionate number of people with serious mental illness behind bars. You put them behind bars, you know, my sort of thumbnail rough approximation is that the prognosis in schizophrenia is better if there are circumscribed incidents of acute psychotic breakdown, decompensation. And then in between incidents, there's a period of remission where the person is relatively functional, right? As the acute episodes expand in time, for instance, it goes untreated and they spend months hallucinating, and when the remission is less complete, the prognosis becomes worse. Is that an acceptable, general, large brushstroke generalization? All right, now we go into prison and we take someone who has schizophrenia, who's suffering from schizophrenia, and it's a black male, and he does things, for instance, getting into fights or breaking rules, and the guards say, he's a bad actor. We need to put him in segregation. And they put him in segregation and say he's got a 4-year term and he spends 3 of those 4 years in segregation. Now, what happens to the acute episodes of psychosis, which almost inevitably happen in that situation? The environment causes psychotic decompensation. And the period of remission between psychotic breaks. What happens is that the individual, in many cases that I've seen, and I've been horrified by this, are chronically, acutely psychotic. That is, they're hallucinating all the time for 3 of the 4 years that they're in prison. Now we release them, they come out in the community. What's their prognosis?
I want to open this up as a 3-way dialogue. So, and I'm going to pose this question to the both of you. Why do so many people not know this information?
That's very interesting. I think Becky and I are working on the same thing here, and she's doing a major media blitz here with the exposure of this data, because we don't want to know. We live presumably in a democracy. My idea as a democracy is you take care of everybody. The function of government is to help the disadvantaged. That's what the war on poverty was. That's what community mental health was about. Community mental health was about providing mental health services to people who can't afford it. And I think most people here work in some version of community mental health. We do not like to think of the fact that we've totally jettisoned the social safety net. We don't have supported housing. We don't have much in the way of health care. We don't have much in the way of mental health care. We don't take care of teen mothers who are struggling. We don't do Head Start. Our public schools are falling apart. We're embarrassed by this to the point of denial, because it's not consistent with our view of what democracy is. Therefore, what we want to do is remove it from our sight. So we put in prison the people who have been tormented by the lacks in our social safety net. Who are they? People with mental illness. There are more people with serious mental illness in prison today than there were in the state hospitals in the 50s.
Wow.
And we deinstitutionalized the state hospitals because of the awful conditions there. The conditions in prison are worse for people with mental illness. So we've disappeared them. Developmental disabilities in prison because we don't provide services for them. Take people who don't do well in school, and back to the trauma idea. I think the reason why a huge proportion of kids who drop out of school and then end up in the track of doing drugs and getting arrested and that kind of thing, they had early trauma, and that's why they didn't do well in school. We should peg that in school. That is, we should work in our elementary schools for not only intellectual mastery, but emotional mastery. We should be finding out who's been traumatized, and we should be helping them with their traumas, because if we don't, they can't settle down and study. So little Johnny, who's typically black, you know, he's a little more energetic than the other kids. He's been traumatized at home. He's seen the dead bodies. Goes to school, they can't concentrate. So they tell him he's stupid. I've seen many Johnnies in prison. That is, they're very, very bright. And they dropped out of school very early or were expelled for fighting or whatever. And they got into trouble. They did drugs. A lot of the drugs, as I said, can be attributed to self-medication for trauma. Then they got caught up in the criminal justice, often through no fault of their own. I mean, a black kid walking down the street is more likely to get arrested than a white kid walking down the street doing nothing. And then if he happens to have a roach in his pocket, he's in trouble. So Johnny got swept up in criminal justice, goes to prison, gets his GED, reads everything they got. He reads their entire library. I meet him when he's 30 or 35. He's never been able to get out of prison because they do successive charges because of the awful traumatic conditions. And he's absolutely brilliant. I'm thinking, I'm talking to someone who's been to college and probably graduate school, and he is so intelligent. And I asked him what happened in school. Well, I dropped out in the 8th grade. Well, they kicked me out because either my grades weren't good. And what was going on in the 8th grade? Well, my father was beating my mother. And I felt awful because I was too little to stand up for her. And this, that, and the other. And that's his story. And now he's 30 or 35. He's facing another 30 years in prison. And he should have been going to college and being a productive worker.
Yeah, I think that we don't know, partly because we don't know. There are a lot of people who don't know about the criminal justice system because we live in segregated communities, our children go to segregated schools, we work in segregated workplaces, and the exposure to the criminal justice system is so disproportionately concentrated in certain subgroups that there are some subgroups of the population, for example, you know, well-educated white women don't know anybody who's ever been to prison or jail. Or maybe know somebody who got picked up for a DUI. That's it. They don't know anybody who's been to prison or jail. Whereas I have some colleagues that are doing research looking at exactly this question, looking at women and how many people women know who are currently in prison. Among African American women, it crosses class lines. So among African American women, 44% of African American women know someone in prison today, have a family member. So African American women, even if they're not a group that spends a lot of time in prison or jail, they know a lot of people who do. And so for some groups, it's not surprising, it's known. But I think then the challenge becomes, well, what do we do about it? And how it is that media outlets fuel fears about crime and victimization when crime is at historic lows. By most measures, crime is at the same rate that it was in the late 1960s, well before the prison boom. But yet, if you watch the local news, watch the national news, read the major newspapers, you would think that crime was up. And so I think there's a disservice that the news media does to educate people. And then I think that, and politicians, of course, where no one wants to come out and be viewed as soft on crime. So I think that there are quite a number of factors that are contributing to the knowledge about the criminal justice system being held in very small pockets of the population. And what I've seen over the last few years, in part because of the fiscal concerns in states, because of the Plata decision here in the state of California, because of the work of people like Michelle Alexander, a growing awareness that just putting people in prison or jail isn't really serving the needs of the population. It's expensive. It's not clear that it's meeting the needs of public safety or concerns about public safety. And it's also not clear that it's meeting the needs of people who are incarcerated, who may have other concerns or other needs regarding education or employment or healthcare or mental health care, that those needs may be much better served in other domains. So I would say I'm optimistic over the last couple of years because I think that there has been a shift. I certainly have seen a shift in the last 15 years in terms of willingness for people to engage in this conversation, and a room like this full.
Awesome.
I just want to add, there's a purposeful component here, and that is the state takes part in it. Unfortunately, a lot of abuse goes on in prison, and particularly in isolation units, which a greater proportion of the prisoners are in. If you want to abuse people, beat them up, rape them, etc., you don't want anybody watching, so you want to do it in secrecy. California, we have a gag order. We have a law that the press cannot talk to prisoners without the express permission and supervision of the Department of Corrections. It's a phenomenal law. Why shouldn't we talk? Why shouldn't we hear the story of all the people disappeared in prison, disproportionately people of color? That's a mechanical way that they're being disappeared. But visiting is a way they're being disappeared. If you go visit a prisoner, I don't know how many people here have visited a prisoner in a state prison? Look around. It's a small minority of people here, but when they put you through things, searches, they keep you waiting, they send you away if you have the slightest wrong clothing on. If you wear clothes that look like the color of the prisoners' suits, they send you away. You can drive 6 hours to the prison and they will send you away. They tried to put people visiting through X-ray machines before they could go in, and then there was a lawsuit that stopped that. What are they doing? The way we know what's going on in prisons is the families tell us. And if they dissuade families from visiting, which there's every effort to do, it's very purposeful, then we know less about what's going on in prison. So we've got gag orders, we've got visiting, which is very problematic. That is a sort of a structured state intervention to reinforce what Becky and I are both saying is sort of a cultural denial that's going on, that we don't want to know what's going on. So the state says, okay, we're going to keep it secret anyway.
Okay, last question. Why is this such an important topic for us to be discussing today?
I'm sorry, say that again.
Why is this such an important topic for us to be discussing today?
Why is it such an important topic for us to be discussing today?
Why is
it an important topic?
Oh, okay. I'm sorry. I'm very hard of hearing, so I need to hear the question 3 times. First of all, I think that prison is a mirror of what's going on in society. I think we have to confront the kind of issues that Becky is raising with statistics and such. Why is it that people of color are the last hired and the first fired? What kind of a democratic society do we live in where that happens? And prison happens to be a place where we've kind of concentrated the problems. So when you see 50% African Americans in prison, you're seeing our employment situation, our labor relations. That's our labor relations. They are the unemployed and discarded people who are not given jobs. When you look at the issue of mental health, I think we do a great job with psychiatric rehabilitation and some of the newer medications if they're not overdosed, and if they're carefully monitored by psychiatrists, and medication alone is not given to people with serious mental illness. Rather, they're given an array of psychiatric rehab and treatment services. We have made leaps in what we're capable of doing treatment-wise and rehab-wise in the last 20 years. It is not reaching everyone. In fact, it's specifically not reaching the very people with the most serious mental illness, and the reason is because they're poor. So we have not figured out a distribution system for everyone to get the services that we now know how to provide. Well, it happens that more people with serious mental illness are behind bars than there are out here in the community.
Wow.
What's that about? And I think every mental health profession needs to look at that as a very serious condemnation of what we're doing.
Thank you.
Yeah, so I'd like to think that we care about this for some moral reason, but that's actually not why I think people are starting to care about it, and what the argument that I've certainly made in other venues is. I think that there are a couple of really important reasons why we care about this now, and I think practitioners in the field, working with children, working in community healthcare settings, they come to me and say, I see this every day. Right, so this is something that has become such a widespread issue that it's affecting day-to-day practice across communities in the country. I think the other thing is that the fiscal concerns are very real. There's a real question about whether this is a good use of state or federal funds. And so that has certainly reoriented the conversation that there may be much more effective ways that we can spend taxpayer dollars to meet the needs of the wide range of the variety of people in the population. And I think the third, and for me, an incredibly compelling reason that this is important is because this isn't just about inmates or former inmates. It's also about their families, their children, and their communities. So at the time of the growth of incarceration, there was also a growth of exposure to incarceration of having a parent incarcerated, so that by 2008, 2.7 million American children have a parent incarcerated today. Wow. Right, so I mean, 2008 was the height of the incarceration boom. It's been about the same since. And so 2.3 million adults are incarcerated. They have 2.7 million children. That's on any given day. Again, those numbers are not equally distributed across the population. Among African American children, it's 1 in 9. 11% of African American children have a parent incarcerated today. That's why people working in schools are saying, this is an issue for us. That's why people working in community health facilities are saying, this is an issue for us. That's why people working in housing are saying, this is an issue for us, because having a parent incarcerated leads to a whole range of issues for their children through no fault of their own. And here's another way of thinking about the same thing, which is the cumulative risk of having had a parent incarcerated. By the level of that parent's education, for African American children, one quarter can expect to have a parent in prison by the time they turn 17.
Wow.
1 quarter. For non-Hispanic white children, it's 4%. This is what I mean by this is highly stratified. But the thing that's really striking to me is that among African American children who have a parent who dropped out of high school, 62% can expect to have at least one of their parents imprisoned.
Wow, that's a lot. I want to take this opportunity to open up the floor for question and answers. So if you could quickly get to the mics and speak loudly so we can hear your questions. Thank you.
Hi, my name is Rocky Jackson. I'm the assistant director with Friends Outside. And my first comment, I guess, for you, Terry, is one of the things that we see at Friends Outside as a nonprofit, we actually run a visitor center at every state prison. So our role is kind of to be in between, in California, the family coming in to see the incarcerated individual. So we provide free childcare, information about community resources. We also provide clothing for that individual if, let's say, the individual says they can't come in to see the incarcerated person. But my question to you, Terry, is there's a lot of research saying that individuals with PTSD often have the same type of symptoms as somebody who's been incarcerated. What do you think about that, and what do you think about treatment for that?
People who have been incarcerated, and what do you think about that, and what do you think about the treatment for that?
You know, there's a book about slavery causing PTSD in all generations of African Americans. And I think it's right. I think it's the right way to look at it. Look at it historically as accumulated trauma. The treatment for PTSD in prison, for instance, would include not punishing people for rule breaking when their rule breaking was driven by their PTSD type symptoms. So there has to be a revision of what we do with people. We're going the opposite way in society, by the way. You can see all of this in the Youth Authority. If you look at the Youth Authority, what's happened over the last 40 years, since the 70s, is the amount of attention to the education of young offenders has been decreasing. That is, the budget for schooling inside the Youth Authority has been going down, as has the budget for mental health services. We have good studies, well, actually they are underestimates, that 1/3 of youth in detention meet full criteria for post-traumatic stress disorder, but we're not treating them. Meanwhile, we're putting them in little boxes, isolation cells of various kinds, even on the yard, and that's re-traumatizing them. So what I think we have to first do is step back and look at the things that are traumatizing people. Poverty is traumatizing. Being stopped and jacked up by the police 6 times a week on the street is traumatic. And we need to stop doing that. So all of the kind of attention to policing with no attention to fixing the public schools has to be reversed, or we're not going to get on top of the problem of trauma. Now, on top of that, the way that you treat trauma is you listen. People of color are listened to. That's what the word disappeared or invisible means. They're not listened to. The way we treat trauma is we listen. That's the main component of the treatment for trauma. So that's what we should do. Spend more time with sensitive people with skills, clinical, rehab, and educational, listening to young people, particularly behind bars, about what's going on in their life, including the traumas.
Thank you. Okay. Go ahead. Speak right into the mic.
So good morning. I wanted to just make a comment. I have a son who's a victim of mental illness, and so he was diagnosed with schizophrenia at 19 after he graduated from the French American Bilingual School. So, and it was very traumatic for me as a parent. But what helped me get through the whole process of that incident was I was advised. I had support from the community mental health system in San Francisco, which I think has no longer exists. You know, the services that I received at San Francisco General Hospital were fantastic. They no longer exist. I went through the National Alliance for Mental Health. I sought out resources, and I think for the African American community, there are not enough. People are afraid of it. People are really afraid of mental illness. When your family member is a victim of mental illness, it's very scary. It's very frightening. You don't know what to do. And so for people of color and people who are poor, you just kind of like let it go. And then they become a victim of the streets. And that is the worst thing. There are not enough advocates in the community when you have a person who is suffering from mental illness. To help give the family support. So I was very fortunate to have had that and to seek it out. Because there were several times when my son was on the street acting really crazy with no shoes on and no shirt, and it was horrible. You know, but people were able to call me and let me know, and then I could go to his aid. But I also wanted to say that in San Francisco, I was listening to KGO one day, and there was a report from one of our new tech people. We have a lot of tech companies that are moving into San Francisco, very rich companies. And so he was being interviewed, and he said that, and it was very insulting, very a lack of sensitivity. He said that we have a lot of homeless who live on Market and maybe 7th right in this area, and he said that they look like monkeys.
Ooh.
On television, on radio. They look like monkeys and they act like they own the street. This group of homeless population, and they wanted them out of there because they've got money. They're rich. They're moving in. They're buying all this property. They don't want that ugliness on their street, right in their area, and when they have to go to BART and walk past all these people. So soon, I'm sure they'll be displaced and they'll be moved someplace, maybe to prison. I'm sure a lot of them already got, either criminal records. But I just wanted to say that there's a lot of insensitivity now to the poor, especially in San Francisco.
Thank you.
You're welcome.
Thank you. Appreciate it. Okay.
Yes, my name is Mel Mason, and I'm Executive Director and Clinical Director for an African, how you doing, Dr. Kupers? An African-centric family resource center called the Village Project. It's in Seaside, California, in Monterey County. And I know that we're going to talk about things like community-defined practices later on, but I wanted to talk about this since you were here, especially Dr. Kupers, and also to both of you. On the other end of AB 109 is when the inmates are being released. And one, when AB 109 started to get worked on in our county, we were not invited. You know, I mean, we were in existence then. We're still a young agency. We'll be 6 years old in May. But we had such a body of work, you know, in the African-American community especially, and in other communities as well, in terms of reducing stigma. Because on the day that we opened up our agency, we're on the second floor of a building, and we had African-Americans lined up for 2 stories signing up for counseling and therapy, which destroyed the myth that black people don't go to therapy, which we already knew, but other folks didn't, or claimed they didn't. But my point here is this. You know, we talk about the traumatization that goes on inside of prison, and I think many of us know that. There's also the potential for re-traumatizing inmates when they come back, right, and they get sent to inappropriate services. Services that don't take into account who they are. Services that have no cultural, well, they have a cultural focus, but it's not theirs. And so when we were not invited to the beginnings of the working out of how AB 109 was going to be implemented in our county, we thought that that was willful. We found out where the meetings were, and we showed up at the meetings uninvited. And we continued to show up at the meetings uninvited because we knew that if we didn't, you know, that there would be nothing for these black and brown inmates that come out of the joint coming back home. And so we continue to raise the issue about cultural competency, cultural specificity, and the need for this kind of program if, in fact, they really want these black and brown inmates to be successful when they come back. It took us a year. We finally got the contract. And then as they begin to filter inmates to us, those inmates begin to do things like go to work, get full custody of children, work on campuses where their children were volunteering. And as one particular inmate, ex-inmate, came back and said when he went to his first parent-teacher conference, he noticed that there were some knucklehead kids on campus behaving the way he used to when he was young. So he said, Mel, I grew up hating cops. He said, so you can imagine what it took for me to walk up to the school resource officer and say, I want to work with you to work with those little knuckleheads that are behaving the way I am. And he's made a difference on the campus. And those are just a couple of examples.
Awesome.
But what I'm saying, though, is that throughout the state, you know, there's probably people who and organizations who are in the same predicament, because our mission has to be to untraumatize, you know, these sisters and brothers who are coming back. But what I think I need from both of you maybe is some ideas or some thoughts or some suggestions for all of our agencies and our communities and stuff to be able to do our job in terms of making AB 109 a reality.
And thank you. And I just want to clarify, because some of you traveled from afar, AB 109 is the assembly bill that is allowing it's the early release program that allows inmates that are nonviolent offenders to get released early and into their communities. So, go ahead.
You want to? Let me just say that the last 2 speakers were very poignant, and these are very big problems. You know, one of the laws we have in this state is that if the state mental hospital feels they cannot handle a patient, they can send them to corrections with no charges, and they'll be housed in a prison. So you get a number, and there are thousands of people who are sent over because they were assaultive or misbehaving in the state mental hospitals. We need to have mental health professionals who know how to handle behavioral situations so that they don't immediately call the police and dump the patients into the criminal justice system. And that's going on all over the state. I think there's a lot of things we can do in the community. It starts with destigmatizing. You know, if there are 2.5 million people behind bars, there's 15 or 20 million people who have been behind bars, or probably a lot more. I don't know where we are with that. That's about right. So there's an awful lot of people who have criminal justice experience. If there is a stereotype, and I believe there is, which is stigma in the community, that these people are dangerous, and guess who is the poster boy for the stereotype? It's the young African-American male. But when you think of criminal, who are we thinking of? And if there is that stigma and stereotype pervasive in our society, then the individual getting out of prison is not going to get services. So that you have the staff of a halfway house saying, I'm afraid to admit this individual because he's been to prison for a violent felony. Well, he could have been, you know, raised his arm when he was arrested and be charged with assaulting an officer, and he could be a perfectly peaceful individual, but he's already been stigmatized before he even shows up at the door. So we have to do something about that stigma. We have to. We're not talking about a few people who do multiple murders. We're talking about many millions of people who are permanently damaged by time behind bars. We have to welcome them back into the community. We have to provide them services. We have to bolster our education system to catch them because they've been failed previously by education.
Thank you.
Yeah, I just want to add one thing. That, this isn't my area of expertise, so I may be misspeaking, but I think the one thing that I've seen is that what I would encourage is networking and community building among the organizations that are trying to work with similar purpose. And so I know there's a conference next week in Washington, D.C. by an organization, I can't remember the specific name, but it goes by Coaches. And it's about community reintegration and the provision of health care. And one of the things that they're really interested in is trying to figure out how to leverage the insights from the, resources from the Affordable Care Act to better serve the needs of not just formerly incarcerated individuals, but others who may have historically lacked access to health care and mental health care in particular. So I would just encourage you to talk to other people who are here and network with those other organizations so that you're leveraging resources and tapping into what is available.
Thank you. Okay, next question.
My name is Yvette McShann. I'm the CEO of Victoria's Black Women.
You talk in the mic.
My name is Yvette McShann. I'm the CEO of Victoria's Black Women. And I want to ask you a question. My question is, when is we going to address the trauma in African Americans by design? It's no coincidence that it's more African Americans incarcerated. There's more African Americans in prisons than in education. And then in the inner cities, their schooling is teaching them to be educated. It's no coincidence that young African American boys are in juvenile. From there, they go to prison. And until we address the trauma in the African Americans in our lives, and this by design, because when crack cocaine came in the community, it changed the African American culture. I've been to every prison in California, but what saved me was a family structure. How can these young children teach themselves? And all African Americans don't have people in jail. I had a mother and a father, and they taught us to go to school, and they took us on vacation. They taught us morals, and they never went to jail. They were homeowners. Until we address this seriously, we just gonna be scratching the surface. Like we have to admit as a society that this is done by design, and you are her victim. And being traumatized, I mean, it's something, you wondering why your life is so crazy, but it's because of the society you live in and you've been targeted. Thank you.
Thank you. Thank you. Any comments from the panelists? Okay.
Go ahead. I think you're absolutely right, and I think it's really important. I mean, one of the things that I talk about often is I think it's really important to focus on the growth of the criminal justice system in the U.S. as a consequence of design, of policy design, and that what we've seen this massive increase in incarceration, and it's most academics agree that it's been about shifts in policing, shifts in prosecution, and shifts in sentencing that has disproportionately affected African Americans, African American men, and especially those with low levels of education. So I think you're absolutely right. And I'd like to imagine that we are shifting the conversation, and that this is I mean, I take this full room as a really good sign that people are increasingly ready to hear about these important issues and increasingly ready to address them.
Yes. And I just thank you for the dialogue you're having. I was in Georgia with professionals and consumers having this same dialogue.
Awesome.
About addressing African American and incarceration. And I thank you so much, and I apologize for being late. But I'm so glad I'm here.
I'm glad you're here. Thank you. Okay, next question.
That's okay. Good morning, Damian King, Rubicon Programs, Richmond, California. Considering the years and years of microaggressions and vicarious traumas by this population we're talking about, what strategies are being developed to convince this population to even buy in to the aggressive approach to providing services to them without them believing that this is just another form of policing and mental slavery?
Excellent question.
And how much should we be considering, or should we be considering having individuals who have actually transitioned, reacclimated themselves to society? How much should they be involved in this work as well?
Excellent question, and that's the last question for now because we're running out of time. So go on and write your questions down.
Let me just say, all of these questions are wonderful statements in themselves, so I don't feel a need to respond to everything. I think what we need to do is bring everybody to the table. You cannot discuss mental illness and mental health services today without addressing the problem in the prisons. We do it, but it's not right, because a lot of the problem is in and hidden in the prisons. So we have to address it. Now, we also have to treat everyone among us as a human being, and we're not doing that. When we send someone to prison and they get put in segregation, they are doubly disappeared. They're disappeared into prison, and then their pain and the damage done by the segregation is ignored by society. Then they get out. And who talks to them? They don't get any services. No one listens in an understanding way. So you were put in segregation for 6 years. What was that like? What was going on in your head during that time? How was your relationship with your mother, or your wife, or your daughter? And listen, and treat them like a human being. Jonathan Kozol said about our education system that our public schools are not failing, they're succeeding. But the job that society gives the public schools is basically to create stratification. So what the public schools are succeeding at is teaching some kids that they don't have it to make it in society. They're failures. And the reason they're a failure is not because our schools are failing by underpaying the teachers and having too large a class. They're failing because they're stupid. So we're teaching a population of people that they're too dumb to make it in the education system rather than fixing the education system. And we're doing that all the way through in all of our systems. And then the damage gets disappeared into the jails and prisons. So that's why this conference is so important. First, we have to pay attention to the problem. Second of all, we have to address the people we're talking about as human beings who have equal worth to all the rest of us. And then once we start doing that and look at their problems as important problems to address, we have to change our services.
Any last comments from either of you? No. Okay, well, thank you, Dr. Kupers and Dr. Pettit, for being here today and sharing your wisdom with us. Let's give them a hand.